Hello everyone, and welcome to today's lecture on obstetric ultrasound and fetal biometry. We will explore how ultrasound imaging can help assess fetal growth and development. We'll discuss measuring techniques, Doppler ultrasound for fetal well-being, evaluating placental function, and identifying fetal anomalies. Let's begin our journey into obstetric ultrasound. The crown rump length, CRL, is measured from the highest point of the fetal head to the spine and is used to estimate gestational age. It is important for assessing fetal growth and identifying any abnormalities or developmental delays. Comparing the CRL measurement to standardized charts helps determine due dates and monitor fetal growth. Biparietal diameter, BPD, assessment is another critical measurement in obstetric ultrasound. It involves measuring the distance between the parietal bones of the fetal skull. BPD assessment provides an estimate of fetal head size and aids in the evaluation of normal or abnormal brain development. By comparing the BPD measurement to standardized curves, we can identify any potential microcephaly or macrocephaly, which may indicate underlying neurological disorders. Abdominal circumference, AC, evaluation is a fundamental parameter used to assess fetal growth and identify any deviations from the expected norm. AC is measured by obtaining the circumference of the fetal abdomen, typically at the level of the stomach and umbilical vein. By monitoring AC measurements at regular intervals, we can track fetal growth and ensure appropriate nutrition and development. Deviations from expected AC measurements may indicate intrauterine growth restriction, macrosomia, or other pathological conditions, warranting further investigations and interventions. Femur length, FL, determination is an integral part of the comprehensive fetal biometry assessment. FL is measured by obtaining the length of the fetal femur bone. It provides an estimate of fetal limb growth and aids in the evaluation of skeletal development. FL measurement is important in identifying potential conditions such as skeletal dysplasias or growth delays. Comparing FL measurements to standardized charts enables us to assess normal growth patterns and detect any deviations that may require additional evaluation. Estimation of fetal weight, EFW, is a crucial aspect of obstetric ultrasound. It involves mathematical calculations using multiple biometric parameters such as BPD, AC, and FL. EFW serves as an indicator of fetal well-being and helps in monitoring fetal growth throughout pregnancy. By comparing the EFW to the reference values, we can identify any intrauterine growth restriction or macrosomia, enabling appropriate management and intervention strategies. Utilizing growth charts and percentiles aids in the assessment of fetal growth patterns relative to the general population. These charts provide a visual representation of various biometric measurements at different gestational ages. By plotting the obtained measurements on the growth charts, we can determine whether the fetus falls within the expected range or if there are any significant deviations. This allows for accurate identification of growth abnormalities and helps guide clinical decision-making. Placental grading and assessment of placental function are vital aspects of obstetric ultrasound. Placental grading involves evaluating the appearance and maturity of the placenta through ultrasound imaging. It helps in determining the placenta's ability to adequately nourish the fetus and remove waste products. Assessment of placental function also includes Doppler ultrasound evaluation of the maternal fetal blood flow patterns. Abnormalities in placental function can lead to complications such as fetal growth restriction, preeclampsia, and placental insufficiency, making early detection crucial for appropriate management. Doppler ultrasound evaluation is a non-invasive technique used to assess blood flow patterns in the fetal and maternal vessels. It provides valuable information about the health and well-being of the fetus. By analyzing the waveforms obtained from various vessels, such as the umbilical artery, middle cerebral artery, and ductus venosus, we can identify any abnormalities or signs of fetal distress. Doppler ultrasound plays a significant role in monitoring high-risk pregnancies, tailoring management plans, and predicting adverse outcomes. Amniotic fluid index, AFI, measurement is an essential parameter in obstetric ultrasound used to evaluate the volume of amniotic fluid surrounding the fetus. AFI is determined by measuring the deepest vertical pockets of amniotic fluid in different quadrants of the uterus. Normal AFI values vary according to gestational age. Deviations from the expected AFI range can indicate complications such as oligohydramnios or polyhydramnios, necessitating further investigations and potential interventions. Fetal growth restriction, FGR, and evaluation of small for gestational age, SGA, fetuses are critical aspects of obstetric ultrasound. FGR refers to inadequate growth of the fetus due to various factors, including placental insufficiency, maternal conditions, or genetic disorders. SGA refers to a fetus whose size falls below the 10th percentile for gestational age. Through ultrasound biometric measurements and Doppler evaluation, we can identify FGR and SGA fetuses early, implement appropriate management strategies, and reduce the risk of poor perinatal outcomes. Assessing fetal macrosomia is crucial to anticipate and manage potential complications during delivery. Macrosomia refers to a fetus with an estimated weight above the 90th percentile for gestational age. Ultrasound biometry measurements, such as AC, FL, and EFW, play a significant role in evaluating fetal size and determining whether macrosomia is present. Identification of macrosomia permits obstetricians to initiate discussions regarding mode of delivery, potential interventions, and manage the associated maternal and neonatal risks. Biometric measurements obtained through obstetric ultrasound are instrumental in evaluating fetal anomalies and malformations. Abnormalities can be structural, functional, or syndromic in nature. By examining the biometry of various fetal structures, including the cranium, spine, abdomen, limbs, and heart, we can identify potential anomalies and direct further diagnostic investigations. Precise measurements aid in characterizing the anomalies, contributing to counseling, prenatal planning, and overall perinatal care. In conclusion, obstetric ultrasound and fetal biometry are essential in monitoring fetal growth, identifying potential issues, and ensuring the well-being of both mother and baby. Evaluating various measurements and using growth charts helps accurately assess gestational age and detect growth abnormalities. Doppler ultrasound, assessing placental function, and monitoring amniotic fluid enhance the evaluation of fetal well-being, allowing healthcare professionals to provide comprehensive prenatal care and improve pregnancy outcomes. Thank you for your attention during this lecture.